Abortion can be defined as the deliberate extermination of human life. It is as if there were no balance between the silence of the unborn and the ignorance of its protector. Why do we as society allow this injustice to continue to occur? We are no better than they who abuse the freedom to choose without conscious thought. With irrational decisions come harsh consequences. These harsh consequences produce life-lasting, irreversible effects. Abortion is damaging to the psychological well-being of women in society. According to Psychology and Health, there is a consensus among scholars in the field that there are at least 10 to 20% of women who have had an abortion suffer serious negative psychological complications. The detrimental and life-lasting psychological effects include some common symptoms of depression, including guilt and suicide. Guilt is the most frequent emotion associated with depression that is experienced from an abortion. According to Psychology and Health, quote, in a major national poll by the Los Angeles Times, 56% of women admitting to a past abortion reported a sense of some sort of guilt. One woman was quoted as saying, "I couldn't stop thinking about this, counting that week in pregnancy I'd be by now, and how the baby would have looked and all that. When I saw mothers with babies in the street, I winced. In my dreams, I saw the hospital, the nurses, and myself in the stirrups." Attempts and ideations of suicide are the most severe stages of depression. These thoughts and attempts of suicide can be attributed to the sense of guilt and remorse that most women feel after having an abortion. Women may have no immediate psychological effects after having the initial abortion, though over time constant reminders of their child that would have been may tear away at their conscience. The weight of personal convictions may be so overwhelming that the woman may not seek help, feeling no resolution but suicide to relieve her despair and pain. According to abortion-opposing views, a recent large-scale Scandinavian study found that within 1 year of the end of a pregnancy, women who had induced abortions suffered a mortality rate that was almost 4 times greater than those women who delivered their babies. And their rate of suicide was 6 times greater as well. A recent study in Wales found that women who had induced abortions were 2.25 times more likely to commit suicide than women admitted for normal delivery. A large-scale California study just recently published reported similar findings. Post-traumatic stress disorder, also known as PTSD, is one of the most commonly experienced psychological effects that women endure from the abortion they've had. According to Abortion Facts and Your Concerns, quote, PTSD overwhelms a person's normal defense mechanisms, resulting in intense fear, feelings of helplessness, being trapped, or loss of control, end quote. PTSD has 3 stages of emotional distress. The first is hyperarousal, second is intrusion, and the third is constriction. Abortion Facts and Your Concerns states that the first stage, hyperarousal, can be defined as a characteristic of inappropriately and chronically aroused fight or flight defense mechanisms. Women experiencing this stage of hyperarousal are often placed within a world of constant anxiety, and indicators of this anxiety may include loss of temper or control, hyperactive behavior, nervousness, spontaneously lashing out at others, memory deficits, insomnia, interrupted sleep, or exhibiting bodily responses when in contact to sight or sounds that remind her of the abortion experience. For example, heart palpitations or becoming diaphoretic when visiting the gynecologist or the sound of a suction machine. Abortion Facts and Your Concerns states that the second stage is intrusion, which can be defined as, quote, the re-experience of the traumatic event at unwanted and unexpected times. It further states that symptoms of intrusion include recurrent and intrusive thoughts about the abortion or aborted child, flashbacks in which the woman momentarily re-experiences an aspect of the abortion experience, nightmares about the abortion or child, or anniversary reactions of intense grief or depression on the due date of the aborted pregnancy or the anniversary date of the abortion, end quote. According to Abortion Facts and Your Concerns, the third and final stage is constriction, which can be defined as the numbing of emotional resources or the development of behavioral patterns so as to avoid stimuli associated with the trauma, end quote. Women experiencing this last stage of PTSD often exhibit a strong sense of suppression related to the abortion and and detach themselves from people closest to them, especially anyone that reminds them of that abortion. Women also lose the appreciation of dreams and goals that were once priceless to them, especially motherhood. Women often find it emotionally difficult to see families with children because of what could have been. This final stage often results in detrimental despair or even death. The evidence that women are highly affected by the psychological effects of abortion is staggering. The emotional pain that women feel can leave an everlasting imprint upon their hearts and minds. Although this is a relatively small example of what effect abortion has on women psychologically, it must be remembered that there are also physical and cultural aspects as well. Despite the fact that our government allows abortions, we must take into consideration how this affects women in the long run. The policies of Roe v. Wade need to be looked at more toward the big picture instead of the immediate one. They need to be overturned, and the only way to do so is for us to contact our representative or senator to have that impact.